Good morning and welcome to today's webinar. I'm Alan Bloom, and presenting with me today is Dr. Margaret Bloom. She will talk to you this morning about some of the additional roles that mental health professionals may have when they have clients or patients who are receiving psychopharmacological treatment. She will further introduce herself when she begins presenting. So, first of all, a little bit about my educational professional background to put what I'm going to talk about today and my approach to it into a clearer context. Well, first, I was formally educated in, a joint psychopharmacology program, and partially psychology, pharmacology, both. And what I did at that time was study the biochemical basis of memory formation. For the last 40 some odd years, I've been a medical school faculty member in the Department of Pharmacology and Toxicology, teaching psychopharmacology to medical students, graduate students, and nursing students, among others. In general, my major research efforts have been in the areas of drugs of abuse, particularly marijuana, cocaine, and nicotine, and more recently also studying the effects of cancer chemotherapy on brain function, in other words, chemobrain. I primarily use functional magnetic resonance imaging to study the drug effects both in humans and in animals. I'm currently Professor Emeritus, so that's who I am. Let's see who's here today. What I'd like to do is just ask you to do some polls, and we'll see who's here today. Okay, so it looks like we have a nice mix of licensed mental health counselors, social workers, substance abuse counselors. We have a good group of psychologists, nurse practitioners, so we have pretty much everybody, and a few of you are prescribers. Okay, good. So I'll keep this in mind as we talk about, what's going on. By the way, here is the statement at the bottom is required by the American Psychological Association. So as we go forward, I must provide you with several disclaimers, of course. First of all, I developed this program myself, so you only have me to blame for it. At present, I'm a Professor Emeritus of Pharmacology and Toxicology at the Medical College of Wisconsin. I do not conduct sponsored research that is funded by nor serve on any healthcare company or drug company advisory boards. I'm not funded by any drug company or other for-profit corporate entity. And all my funding in the past has been either from the government, NIH, or the Department of Defense, the VA, or voluntary organizations such as the Alzheimer's Foundation, March of Dimes. I am a member of the State of Wisconsin Controlled Substance Board, though this is not part of any official act on my part of doing this. I receive an honorarium from PESI for doing this. I enjoy doing it thoroughly, but I'm not stupid, And the drug uses presented, this is important, are FDA-approved indications, unless otherwise stated by me or indicated with an asterisk, and I'll keep reminding you of this. So why am I presenting this program? I think it's become quite clear that the use of psychopharmacological agents is an essential part of, or at least a useful adjunct in the treatment of mental health disorders. If you want, many of your patients or clients will have had them prescribed for them, and there are others who you feel will benefit from them. And of course, you may be a prescriber yourself, if we have a few in this audience. Then, of course, there are other persons who are using prescription and other drugs inappropriately or to excess, and I'll finish this session talking about that. In other words, drugs are or will become part of your professional efforts. So with that in mind, I'll first present some general information on where and how drugs act in the nervous system. Then I'll talk more specifically about the various classes of drugs used to treat some of the common DSM-5 mental disorders, and use that as a focus point. Lastly, I'll spend a few minutes discussing the growing problem of drug abuse.